Welcome to the FMP Essentials Show. I am Dr. Yousef Elyaman, your host, and I am thrilled to have you here with us. Whether you're a seasoned functional medicine practitioner or just starting out on your journey, this show is going to be a go-to resource for mastering functional medicine and making a real impact in your practice and community. Thank you for joining us on the FMP Essentials Show.
Disclaimer: the information presented in this podcast is for educational and entertainment purposes only. It does not constitute medical advice and should not be used to diagnose, treat, cure, or prevent any disease or health condition. Any statements or claims made about specific supplements, nutrients, or other products have not been evaluated by the Food and Drug Administration. Supplements are not intended to diagnose, treat, cure, or prevent any disease. The views and opinions expressed by guests on this podcast are their own and do not necessarily reflect the views of the host or producers. We are not responsible for and do not endorse any statements made by guests. Listening to this podcast does not create a doctor-patient relationship and does not give listeners the right to practice medicine or provide medical advice to others. Only licensed medical professionals can legally practice medicine or provide medical advice. Always consult with a qualified healthcare professional before starting any new diet, exercise program, or supplement regimen, especially if you have a pre-existing medical condition or are taking medications. By listening to this podcast, you agree that you understand and accept this disclaimer. Now get ready to dive in and enjoy the show.
Hey everyone, Dr. Yousef Elyaman here. Welcome to the FMP Essentials Show, your resource for functional medicine practitioners. I would like to welcome a special guest today, a good friend of mine, Dr. Rajka. Dr. Rajka, give us your 76-second bio.
Well, I'm a functional medicine MD like you are, medically trained, certified by IFM. I have an expertise in longevity, hormone replacement, and nutrigenetics. And despite being fatigued all about 3 decades of my life, I now have earned the nickname of the Energizer Bunny from my peers and colleagues. And like you, probably take care of a lot of other doctors, even functional medicine doctors. And sometimes I'm referred to as the go-to doctor for doctors.
Nice, nice. And I like that from three decades of having low energy to the Energizer Bunny. That is awesome. So let's take a crack at rheumatoid arthritis. So first of all, tell me, why did you choose the topic rheumatoid arthritis?
Twofold. The first reason is that, growing up, my parents grew up in Eastern Europe, and as my dad emigrated across, he developed an autoimmune disease. His was not RA, but then he brought across his sister, and she developed RA, and then her daughter had RA and 3 other autoimmune diseases, and it seemed to be rampant once they became westernized. And the second reason is it's the first case that I was able to treat someone without having a lot of labs on hand, particularly genetics. And I was able to reverse engineer a patient's reversal after the fact and said, oh, that makes sense why what I advised on a protocol, why that worked based on her genetics after the fact. So it was a pretty cool case.
Nice. So you have a personal reason, you have it kind of runs in your family, but also you've had success with patients and you have a particular case that kind of opened up your mind or opened up your eyes to it. So
yeah, absolutely.
Okay. So I know that in the conventional medicine world, these rheumatologic conditions can be very challenging. And yes, as functional medicine practitioners, they can be challenging as well. But I feel like we have a little bit of an edge because we study what's causing things in the first place, the pathogenesis. But starting off, like you mentioned, you're an MD, I'm an MD. We are working because we're functional medicine. That doesn't mean we're not MDs, and we do some of the same lab tests that a physician would do, that a conventional practitioner would do, but we do some extra stuff as well. We look a little deeper. So let's start with just a diagnosis. How do you diagnose rheumatoid arthritis?
Clinically, and then with lab studies. So typically, joint pain that's worse for 30 minutes or more than 30 minutes in the morning. And then laboratory studies, if it's been ongoing, maybe you'll see that rheumatoid factor come back positive. But if it's earlier on, you may only see the CCP antibody present and positive, which can show up 10 years prior to the manifestation of the diagnosis.
So you'll check a rheumatoid factor, you'll check a anti-CCP antibody. You mentioned joint pain, morning stiffness, right? More than
Correct.
6 months, right? More than 6 months. And
Yeah.
then okay, and then you and that meeting all the criteria, you would make the diagnosis of rheumatoid arthritis. What about radiographs? Would you be getting any particular radiographs?
So I haven't. I've had the luxury of either they come to me on biologics wanting to get off, and so then they're really limited in pain, or they're early on.
Okay,
And can I just tease you for a moment?
sure.
I always say the diagnosis really doesn't matter because we're still going to approach it the exact same way for every case, but maybe a little bit more targeted. So it does matter, but it doesn't. So that's where I wanted to tease you a little bit on how do I diagnose it. So I'm looking at removing the triggers for inflammation, which is what restores the balance.
Right, and I think no, tease away. The I think with functional medicine, we make sure that we're covering our bases, we're covering the guidelines, we're properly diagnosing with a conventional setting, but then we realize that everybody's unique and we want to do that personalized medicine and we want to see what is driving one person's rheumatoid arthritis might not be driving another. So I would say we get x-ray. I know, so they probably already come to you with x-rays, but you would get x-rays of the hand, right? Maybe an x-ray of the neck,
Yeah.
because those are some common rheumatoid arthritis areas. So let's say now you have that person, they've met the diagnostic criteria, they have rheumatoid arthritis, and now you want to dig deeper into what potentially could be causing the rheumatoid arthritis. So what is it that you would, what other tests would you start taking a look at? And maybe let's start with what the conventional lab would have, and then
Mhm.
we can talk about maybe some more specialty tests that the accuracy of some of them, they may vary in accuracy, but they may give us like a piece to the puzzle. So what would you check in just a regular lab, like just a regular, the local lab? What tests would you look at?
So my well panels consist of, obviously CMP, CBC, full thyroid panel looking at free T3, free T4, TSH, reverse T3, and the two thyroid antibodies, thyroid globulin antibody, thyroid peroxidase antibody, vitamin D, omega-3 index. I look at a zinc copper panel in every single person. So zinc, copper, and ceruloplasmin. And then homocysteine. I know I'm missing a few on this. I do an advanced lipid panel. As far as rheumatoid, does that help? No, but just I'm looking at everything. That includes the with the LDL particle count, oxidative LDL, MPO, LPA, PLA2,
Okay.
the apolipoprotein B and lipoprotein A. And then I actually look at a real detailed nutrient panel just through LabCorp or your local lab that
Okay.
looks at, a variety of things that could lead to mitochondrial dysfunction. So low B12, carnitine, CoQ10. So kind of all the standard, I'm looking at zinc, selenium, iodine, iron. I mean, all the things that can lead to even thyroid dysfunction. So it's about 10 to 12 different nutrient markers that I'm looking at just through the local lab.
Okay, so you have like a standard panel that you do on most of your patients just to kind of get a better look. And I mean, we can start going through them. So you have the CMP, which is a complete metabolic panel. That's going to check liver enzymes. That's going to check your electrolytes. That's going to check your blood sugar, right? And just from like a pathogenesis, pathophysiology point of view, you kind of alluded to that, you know what, the diagnosis doesn't matter, but it does matter type deal.
Yeah.
So basically, rheumatoid arthritis is an autoimmune disease. The body is attacking itself. And we
Mhm.
know that high blood sugar, if you have higher amounts of blood sugar, that can increase your risk of getting autoimmune diseases. So, and that would be one of the things that would
Yeah.
make the body, could potentially push the body or make the body attack itself. You mentioned a CBC, a blood count. So from a rheumatoid arthritis, if depending on how long they had it, you potentially could be anemic. You could get what's called anemia of chronic disease. Your platelets could be elevated because that is when those are high, that kind of points towards you having inflammation. And then you mentioned a more complete thyroid panel, right? So, and that's so with the thyroid panel, you also mentioned the anti-TPO and anti-thyroglobulin antibodies. Can you talk about that? Why do you check those?
So if they have one autoimmune disease, I'm looking to see is anything else flagging. And for that matter, if they're eating gluten, I'm always looking at a comprehensive celiac panel. I'll look
Okay.
at celiac genetics because if they have even one gene positive, I'm looking at the celiac panel once a year. So I tell them I want to, keep screening because a lot of people they won't be committed to eating gluten-free unless it really makes a difference. And for rheumatoid, a lot of times it really does make a difference. And we all know that it propagates leaky gut or intestinal permeability if you want to be more scientific about it. So yeah, it's just to kind of give me more data. And a lot of people want the facts to say, well, why do I have to be gluten-free? Like, why should I be, And they obviously clearly if they remove it and they feel better, it's as great of an indicator as any lab test. When they put it back, they flare, then they know it's their trigger. So it's not as much, but some people don't get that drastic of a response.
Right. So back to the thyroid antibodies, like you had mentioned. So for those people that because for our functional medicine practitioners, we're going to have functional medicine practitioners and functional medicine champions watching this. The functional medicine practitioners are going to be the ones they could be an acupuncturist that is also incorporating root cause medicine. They could be a nutritionist. They could even be a health coach that is really just studying functional medicine and trying to learn like how the body works to kind of help empower patients. And then the champion is the one that is all about functional medicine. And then you have those people that are practitioners that are also non-healthcare people that are watching this that have no idea that probably by the end of this episode, they are going to become huge champions of functional medicine and practitioners. It just happens all of a sudden. So it usually happens at about minute 31. You just look, and you're like, oh my God, I feel the glow. There's something happening to me. But let's go back to those thyroids. So we talked about the two antibodies, which what's interesting is conventional medicine usually isn't going to check that. They're going to check if somebody's tired or if they have pain. They might check a TSH and a T4, and they're not going to look at all the other thyroid markers. And we're going to have another show about the thyroid markers, but the TPO and the thyroid, so the thyroperoxidase and thyroglobulin antibodies, which you can check at any lab, is basically telling us that the body is attacking the thyroid. And like you said, autoimmune diseases where the body is making antibodies attacking itself go together. So if you have TPO and thyroglobulin, if you have rheumatoid arthritis, there's more of a chance that you might have some sort of autoimmune thyroid disease happening. Now, what do you do if the rest of their thyroid levels are fine, but then they have these elevated thyroid antibodies?
That's a great question. So I don't tell them that they have Hashimoto's. So patients come to me and say, oh, I have Hashimoto's. I'm like, no, you don't have Hashimoto's yet. And you may never have Hashimoto's. The more it just puts you at increased risk of developing it. And then I tell them that it's our tip off that something is triggering your body. There's a trigger triggering your body to recognize your thyroid as foreign. So we need to find out what that trigger is.
Right. And you had mentioned a celiac panel. So there's this concept of molecular mimicry. And molecular mimicry is when something can look similar to the body, and the body will attack it and then turn around and attack itself. And the classic example of that is rheumatic fever, because in rheumatic fever, what was happening is people would get strep, and then the body would attack strep, but there was a region on the strep bacteria that looked like heart valves, and it would turn around and attack the heart valve. Same thing potentially with a preclinical Hashimoto's, or where the body is attacking the thyroid, or also when you have the autoimmune condition where rheumatoid arthritis, the body is actually what's interesting about rheumatoid arthritis is one of the things that we look at is we're looking at rheumatoid factor, which you mentioned, and that can be positive.
Mm.
What many people don't know is that rheumatoid factor is actually your IgG, one of your antibodies, attacking another antibody, IgM. And by attacking that, you're getting these complexes that go and they deposit in the joints and things like that. So you mentioned kind of a celiac panel, because if they have celiac disease is a condition that can affect the gut, but also affect other organs of the body, where the body can attack gluten and then turn around and attack different parts of the body. You also mentioned vitamin D. So why would vitamin D in a rheumatoid arthritis patient, why would vitamin D be important?
So it's one of the key nutrients that I look at that help regulate our immune response. So, autoimmune condition that's an abnormal immune response to something that's not foreign. Your body tissue is not foreign. So, and as you know, it's one of the most common vitamin and mineral deficiencies across the board. And I have only really met one person who didn't take any vitamin D and got sun exposure and was fine. One. So everyone I test is either completely deficient or insufficient. So meaning that they're not, I like to keep those patients above a certain level. So to ensure that there's a properly functioning immune system.
Right. Now, do you shoot for higher levels of vitamin D if they have autoimmunity? Like, so that we have the lab, and the lab is going to say, most labs will say about 30 to, some will say 20 to about 100 is normal, right?
Yeah.
So if they're 31, then then the provider will look and say, oh, you're fine. Your vitamin D is fine. Is there a number you look for? And is it different if they have an autoimmune disease?
I try to keep most people 60 to 80. Some people say 50, but
Okay.
60 to 80. So it doesn't get them into trouble. So I don't go any higher than that, but I'd love to hear from you. Do you go much higher than that?
I greater than 50 is usually what I shoot for. Like right over 50 is fine, and that's the 25 OH vitamin D, the storage form. But if they have autoimmunity, I may go up to that 80. And we're gonna watch and make sure that their calcium levels go up. And calcium levels really shouldn't go up unless they have an underlying condition where they are rapidly converting vitamin D to the active form. And you had mentioned sunlight, so sunlight is how we convert, our body actually turns cholesterol into vitamin D. That's how our body makes it. But what about milk? Would you tell them, if they have low vitamin D, how many cups of milk would you tell them to drink a day?
So I probably wouldn't tell them to drink any milk. So I don't think most people need any milk whatsoever. So there's plenty of sources for calcium out there. And milk, I mean, everyone's got their different opinion. New autoimmune or ongoing, they really need to do a trial off for a period of time. Usually, I'm telling most of my autoimmune disease sufferers, gluten, dairy, sugar, soy, out for life. Obviously, most people are going to soy if you get it organic, not in GMO, probably, do a trial back. Sugar in moderation, every culture, every kind of, even religion has feasts, times of feasting and times of fasting. So in moderation, at that birthday, have that gluten-free piece of
So
cake. Teasing. But yeah, I usually have them remove dairy. So I'm
dairy.
not, yeah.
Yeah, they're coming off dairy. So we can't tell them how many cups of chocolate milk they would need to get their vitamin D levels up. Well, that's rough. But chocolate's healthy. Isn't chocolate healthy?
As long as I think it's over what, 70% cacao and dark chocolate. And
All right.
so
Fine. All right.
let me see if mine here. Okay, I try to buy it. Yeah, 70% here. So
70%. What
yeah.
if yours said 65? Would you have changed your number?
No, I'd say I wasn't being as clean. So I probably have maybe up to a bar a week, have a little snack here and there. And it's not, I don't know. And it usually, like, I don't crave it all the time. Yeah. And it's, chocolate's it's a methylator. So it does turn the brain on a little bit real. So I knew I was being interviewed by you today. So I had to make sure I was sharp today.
Yeah, no, that's why, man, and I didn't have any chocolate. This is not fair. So when patients ask how many cups of milk, because milk is fortified with vitamin D. So when they ask how many cups of milk, The typical dose, and maybe you can tell me your experience, the typical dose that people need just to get their vitamin D levels normal, I found about 5,000 units. Now, I don't recommend that they go higher than 2,000 without checking levels, but that's where people get confused. If you checked with your doctor and your doctor is saying you're low, you don't have to stick to the 2,000 or less a day. We're going to give you vitamin D. We're going to check your levels. We're going to make sure everything's okay, and we'll find the right dose. But 5,000 has been, international units has been the dose that I found most people need. Some people do need more. Some people do need less. And that would be 50 cups of milk. So I'm like, go ahead, drink 50 cups of milk. And after you have a little bit of diarrhea, you lose a little bit of weight, then you'll feel, then we'll kind of, you can take this pill. Now, I especially if they're past age around 35, I like giving a little vitamin that you can get the vitamin D and K together. Is that something that you do?
I do, and you know what? In my women of past childbearing age, and in my men, I give K alone, like straight 80K, because, and I'll give the A in retinol palmitate. Here's why, because I do a lot of nutrigenetics. I think we might have slightly different demographics, but I'd agree with you. 5,000 on the D, almost universal for all adults. Sometimes in the summer, I can drop them a little lower, but in the winter, I'm finding it's 5 to 10,000. There's so many people that have genetic mutations and they can't either transport the D or they can't activate it or whatever, and they're needing much, much higher levels. I don't use genetics for vitamin D. I always say, I don't care, I replace you to the level you need to be. But there is a gene that doesn't allow you to activate vitamin A. And those are the babies that if you have children that deposit the orange around their nose when you feed them a lot of sweet potatoes and carrots. That's not healthy. That means they're not activating it. And so I, as a blanket term, give them a little bit. But you got to be careful when it's a woman of childbearing age because their multivitamin will have A. And then I don't like to supplement it because they won't pay attention to that. It's in this separate thing. But yeah, so for
So
anyone
you
that
make
has,
sure, so you're making sure they have their A as well. The K, I think, so I like adding K. I do a lot of cardiometabolic health and so we normally get vitamin K from our leafy green vegetables and you need good bacteria in your gut and that
yeah.
will turn the K1 to K2 and then the K2 is like that form that the body uses and so many people are not getting the greens or don't have the right bacteria in their gut and that's why it's in the same pill. They have to take a pill anyway, might as well throw the K. And then K is going to be good for strengthening bones, but it also vitamin K is going to be good to stop calcifications of the blood vessel. Now you mentioned also an omega-3 index. How is tell us about an omega-3 index? What is that looking for and how is that going to help you with rheumatoid arthritis?
So omega-3 index measures the total amount of omega-3 fatty acids in the body. And the omega-3s help regulate immune function as much as vitamin D does. So it's my top, it's the second of three that I really like to target. And I like that index to be up at 8 for most people. And when you measure across the board, people were coming in at about 3 to 4 if they weren't supplementing at all. That's really pretty low. Important for brain health, important for immune function. And lately I've been seeing them between not 3 and 4, but between 2 and 3. And this is like someone, and they'll say, oh, I eat healthy. You'd have to be eating a whole lot of fish. And it does help. Yes, fish helps, but you're not going to hit 8. And as you may know, the data with the Framingham study, they showed a reduction in mortality. I think it was by all-cause mortality by having an index of 8.0. And I bet you with your cardiac patients, you probably drive them a little bit higher than that, right?
Yeah, sometimes, and we actually look particularly at the EPA, the
Okay.
EPA levels, and EPA and DPA opposed to DHA.
Yeah.
And for our cardiac patients, a lot of times we give a high EPA, low DHA omega because the EPA will become DHA. We've just found that that works better for them. But what's cool is that we're looking at omega-3s and omega-3s are needed for immune system, and they're needed for brain function, and they're needed for heart function. They help with inflammation. So we're replacing what the body's missing. And one person may have low omega-3s making rheumatoid arthritis worse, but another person, it might be affecting their memory, and one person, it may be causing their triglycerides to go up. So that's where I love functional medicine. We're just finding out what is low and we're rebalancing. And
Mhm.
like you said, you can start with some of those low mercury, higher omega-3 fish, but you can also supplement and give it as a supplement. But I do caution patients that they make sure that it's pharmaceutical grade
Yep.
and that it's not expired and that it has to be a brand that they trust and if it's expired, then actually it gets oxidized or rusted, which could cause more of a problem.
Yeah.
And make sure it's tested for heavy metals as well, because the last thing you want in a patient with autoimmunity is give them heavy metals, and they start taking in mercury and things like that to make the problem worse. Now, you mentioned a zinc and a copper. Tell me about that. Why would that be helpful here?
Zinc copper ratios normally are probably more helpful. Zinc levels would be that third nutrient, the key nutrient for immune function. But
Okay.
because I'm screening, I found more helpful when that ratio, the free copper index, which is a calculated value, where you take 3 times the protein that binds copper and
Mhm.
subtract it from copper, and you want it under 30 for brain health. But if you talk to some of the leading researcher, Dr. William Walsh is one who studied it extensively for over 40 years. He'll drive people below 25 or even 15 when they have anxiety, depression, actually OCD, any of the mental health symptoms. And I'll tell you, if copper overload or free copper index being high is their main issue and they have anxiety, you can shut them down within 2 weeks. It's so fast. But beyond, and it's mostly anxiety and OCD and panic work. If that's their main issue, you can shut it down very, very fast. The rest of the stuff, it takes some time. So like schizophrenia, I don't treat schizophrenia. I think they're probably better off, having a psychiatrist on board as well if you're going to be doing that. Just my personal opinion. And depression probably not as quick. I haven't seen that results, and it's not everyone. It's a small portion, but you don't want to miss it. But when it comes to rheumatoid arthritis, I'm mostly looking for the zinc, and the rest is just to round out. I'm like, what do I want to see in everyone? I want, even if they're
And
20, you want them to be optimal from all standpoints.
so tell me about that ratio again. So you said you get a free copper. Where do you get that done at?
So you just measure the total copper. So
Uh-huh.
copper in plasma or serum.
Uh-huh.
And I use LabCorp here because it's nationwide. We have a local lab that does the same. And then I measure ceruloplasm. And so if ceruloplasm say the copper is, we're going to make this really easy math. Say
Hmm.
the copper is 100 and ceruloplasm's 30. So
Okay.
ceruloplasm is what binds the copper. And you take 3 times ceruloplasm. So that gives you, if it's 30, 90. 100 minus 90 is 10. So the free copper index is 10. So you can
Okay.
calculate it. There is a online calculator I use that will calculate percentage. And then you want the zinc and copper ratio to be about 1 to 1.
Okay. Of the free?
No, no, no. Total zinc, total
Okay.
copper.
So what do you do with the free? So you look at the free. Let's say the free copper is 10. Then what?
Yeah, that looks good. Say if it were elevated, say their free copper comes back at 45 or 50. That's really high.
Okay.
Um,
So
yeah,
that's not a ratio. That's just how much free copper they have.
correct.
So ceruloplasmin is the protein that binds copper. And
Correct.
a lot of times we'll see people that will think that their copper is low, but we check their ceruloplasmin and that's also low. And that mean and their free copper is actually high. And that's where I usually do a 24-hour urine copper. But so the problem is if your copper is high and your zinc is low, that can cause issue. Actually, high copper causes oxidative stress or rusting. So if
Okay.
you don't have zinc to counteract that, rusting is another thing that can cause autoimmune disease because rusting changes the way that our tissue looks. And if our tissue looks different, the body can attack it. Just like having high blood sugar or having that insulin resistance pointing towards too much sugar, what happens is that sugar caramelizes your tissue and then now your tissue can look foreign, and that increases your risk of autoimmunity. So yeah, I like for a zinc copper, I want my zinc to be 0.8 up to 1 for every 1 copper, and I think you do the same thing, right?
Yeah, correct,
So
correct.
if your copper is 150 and your zinc is 80, then we need to give them zinc, right, to
Correct.
counteract that, right?
Correct.
And you
And
had
yeah, I use, and wait, I have to joke a little bit. You're speaking my love language when you talk about that oxidative stress, because it's like that. It's why, like, I just love the oxidative stress pathway, particularly as it applies to SOD and catalase. And we'll get into more of that for some of the more advanced listeners you have on here.
awesome, awesome. All right, so we talked about a zinc and copper. You talked about a homocysteine. So, right? So tell us, what is homocysteine for those people that are just, for the person that's the functional medicine champion that might not have that much of a medical background, what is a homocysteine?
So it tells me how well. So fancy terms are, it measures methylation. That doesn't mean anything to anyone who's not in the medical world. It tells me how well you're able to turn off your defective genes. So you have to have your what we call methylation pathways working. It's also a way of getting a roundabout way to see what the minerals that drive this pathway are about. So think B12, vitamin B12, vitamin B9, B6, those are kind of the top ones, trimethylglycine. So these are the things. So in an optimal range, I like my patients 6 to 8. So that's the sweet spot. So if you're driving that higher, it can increase the risk for clotting, as you know, particularly in people who have underlying heart disease. Driving it low, you worry about, hey, you're not, that you're going to be causing cancer. So giving people too many methylation products. So you got to have it in that sweet spot. And then you can also drive someone and make them a little nutty so they can get ragey, and you don't want that either. So I kind of keep them right there. And I'll tell you, there was a mom that wouldn't get blood work on her kiddo, and he was starting to just act out more, and his homocysteine went down to 4. Well, I kept saying, we need to get this checked. We need to get this checked. And so she finally said, you're right. We need to get this checked. And in the meantime, we held the active B vitamins and then adjusted his dose. So,
Okay. Yeah, and homocysteine, it's the body will makes it. You need homocysteine for life. It ends up becoming it comes from methionine and for those biochemistry students, and then homocysteine can end up helping go through the methionine synthase pathway, and it will become methionine again. So kind of the body recycles it, or so homocysteine can become different things, but when it is elevated, it is a toxin. And toxicity is another cause of autoimmunity, because toxicity changes the way that the body looks, and if you change the way the body looks, it increases the risk of autoimmune conditions where the body attacks itself. You mentioned advanced lipid testing, where what I like about advanced lipid testing is a lot of times it will check those markers of inflammation, right? You can also check for what's called oxidized LDL. So if the cholesterol is rusting, so that's another. If rusting is happening, that can increase the risk of you getting autoimmune conditions. So that as well. And then high sensitivity CRP is that inflammatory marker for inflammation, or LPPLA2. And then what about so I think from that aspect, we talked about just the basic blood work, the electrolytes, we talked about blood counts, we talked about thyroid levels, and maybe some indirect markers of, is there an autoimmune condition happening with the thyroid? We talked about vitamin D, and the vitamin D is needed for the immune system. And we talked about zinc and copper ratios and omega-3s, and we talked about homocysteine and trying to optimize it. Is there, and you also talked about getting free copper ratio levels as well. Is there anything else, any other tests that usually would want to do for somebody with rheumatoid arthritis? What
besides
about gut health? Do you do anything with gut health or microbiome or?
Yeah, absolutely. So, if I had my way, I would do a stool test. I like running, there's a variety of companies that run 3 samples, so a little more accuracy. So to look at what is the good bacteria? What is the bad bacteria? What are the bacteria we can identify that can be involved in this molecular mimicry? Like Klebsiella pneumonia has been identified as one of those agents, and that's what my one patient had. So even though she had rheumatoid, and I don't think it's specific to rheumatoid, but that's what she had when we targeted it. And it looks at just overall, are you making enough enzymes? Here's a key thing that I love in some of the companies that don't measure this is what are the short chain fatty acid status? And that fancy term, as I always tell people, is that your bacteria chomp on your food, the resistant starch, and it releases fuel for the human. I'm like, so essentially bacterial poop is fuel for us as humans. And that is in the form of short chain fatty acids. And it's really governed by the variety of foods that you eat. And I tried to tell people, I want you eating at least 35 different plant-based foods a week. In addition to
Bacterial poop,
Mhm.
we need their poop and they need our poop.
Correct.
Okay, so we need each other's poop. Interesting. Okay, I think this is a good start. I mean, for somebody with rheumatoid arthritis, you talked about putting them on specialized food plans where you go the foods that are more likely to cause autoimmunity, like you said, gluten-free, dairy-free. What else? What else would you
I do gluten, dairy, sugar, soy. I tell people with
sugar
autoimmune,
and soy? Okay.
sugar and soy. And then for some people, we do, and the literature doesn't say yay or nay, but if they've got joint pain, I say it's worth taking nightshades out for 21 days only. Your
Okay.
potatoes, tomatoes, peppers, eggplants, and then you put them back in. And if they don't cause joint pain, you're fine. I found that raw peppers were a big trigger for me. And so I have a little underlying OA, and my osteoarthritis is definitely controlled. And it's from I had an ACL injury, and the reconstruction sets you up for arthritis. So I wish I would have known then what I know now, because if you stop that inflammatory cascade, you can stop the joint from deteriorating. And who knew, I was just pain free. There would have been things I did differently. But and then for some people, I'll do it in tiers. I like, and then I'll look at, is it nuts, eggs, grains, and it depends on how aggressive they want to be. The more pain they're in, and I tell them we still have to rotate you through foods, or if you narrow them too much, you can add to that problem of low short chain fatty acids. So I'm real careful. So if we're going to do something very restrictive for a while, I'll give them butyrate unless they tell me, no, doc, I've got this. I'll rotate through the other 50 foods that I like to eat or whatever. And I'm not going to stick to the same 10 things, because that could be, as I don't know if you've seen this, but I've seen this, is that we're really well intentioned with an elimination diet, but a lot of times we don't emphasize the need to come off of it. I can't tell you how many people come to me because we tell them so much. I think this is what happens, that they miss that part that yes, you can reintroduce these foods over a period of time.
Right. So they end up with this overwhelming restricted food plan and they don't know what to eat. And then now the body is now they're stuck on these limited foods, and then sometimes they still don't feel well, and then they're stuck. Yeah, no, I think rotating foods is important. I think if you can find those few key foods that may be fueling the issue. And then back to the gut, like you mentioned, increased intestinal permeability. If you have inflammation in the gut, then what happens is that large particles that normally wouldn't make their way into our bloodstream leak into the bloodstream. And when they leak into the bloodstream, they can affect the different parts of our body. Whereas if you can heal the gut, then certain foods that maybe bothered you before aren't going to bother you anymore. And what I've also found is having them do trauma work, psychological trauma work, because what one of the theories out there is that when you are in a stress state, you become hyper vigilant. So like you're stressed out, you don't know, your life is in danger. Someone walks by, you jump a little bit. Well, the body can do that as well when it's not feeling well. It can be in this stressed kind of state. So something that a small amount may not cause a problem, but a large amount would, your body reacts to it. So, all right, I think that was a great overview or a start for somebody with autoimmunity, looking at, or in particular, rheumatoid arthritis, looking for specific underlying imbalances that may be causing it. And now it's time to spill those functional medicine organic beans. Let's go over some of those things that you're not going to learn by Googling or by artificial intelligence, like an AI search. Let's talk about your clinical experience. To unlock additional premium content, including the deeper dive in this clinical topic, leadership and speaking tips, charting and efficiency pearls, and business mastery as a functional medicine practitioner champion, be sure to check out our mastermind and other membership programs at www.fmpessentials.com. Hey everyone, we hope you're enjoying the FMP Essentials show so far. Pretty amazing, isn't it? Remember, if you're part of our mastermind, don't miss out on our exclusive bonus clinical content. That's where we take a deeper dive, look at personal experiences and real-world insights that you can't just get from a book or from looking on AI. It's where we really get into the nuances that make a difference in your practice, the experience of the guest of our show. Thank you for watching, and we hope you enjoy the rest of the show. Part 6, making an impact. So, when you look at your functional medicine practitioner as a tree, when we talked about the clinical topic, learning that clinical knowledge is the trunk of the tree, right? That holds everything up. But eventually that tree, it branches out, and that tree has leaves, and that for photosynthesis, and the tree also can make fruit, and then that fruit can have seeds, and then we can plant those seeds. So planting those seeds is really working on our legacy and making sure that our impact goes beyond our individual practice. Like it goes beyond perpetually. So before getting to this part, the making an impact and legacy, is there any exciting areas of study or projects that you're working on right now that you're just excited about?
I would say all the work that I'm doing with longevity. So super excited because, and I've been mentoring now with all my high performers that want this kind of work, doing the true age test for biologic age, pace of aging. And I'm passionate because the last thing I want to do is live long and not live long well. And that's the last thing I want for people. And we all know people that are very close and personal to us that have not aged well. And there's nothing that breaks your heart worse, whether they've lost their mind or they can't get up out of bed and care for themselves. And nursing home care, let's face it, you can pick the best of the worst and you're still going to get pretty bad care. And that's at over $10,000 a month in expenses. So I'm passionate because if you can reduce that biologic age by 7 years from your birthday, it equates to a 50% increase in longevity and a 50% decrease in mortality, but it also equates to quality of life. So I'm not trying to extend anyone's life and make them live poorly, but extend their life to the point of where they can wake up on their last day on this earth, have breakfast with their spouse, make mad, passionate love, go on a hike, come home, maybe go dinner out with friends, see a show, go to sleep, and peacefully pass away in your sleep. I mean, that would be like the perfect last day, right?
Right. So,
Or something.
and I have this visual image. Like that was of this person just going and smiling and passing away, moving on. The soul just moves on. All right.
Yeah.
So at FMP Essentials, we strongly believe in giving back and making the world a better place. So let's go over how practitioners can make a difference. So the first question, what are some impactful ways that practitioners can contribute to their communities?
So I publicly speak for free, so I don't charge, particularly youth. Our youth is our next generation. I volunteer here locally. My daughter and I are part of a an organization called National Charity League. It's mothers and daughters serving communities. There's Young Christian League, I think it's YCL, YLS or something for men. Ours is not faith-based. I mean, there is a background, but you don't have to be of any certain faith. And so we have a certain amount of hours that we like to do. And then it's always donating your time, donating your services, donating your money. And for services, there's a number of pro bono patients I take per year as well. So not everyone can afford it. And what else do I do? Obviously, I gift money to various charities. Last year, I donated $15,000 to Jeff Bland's functional medicine charity. So that's a
Okay.
substantial amount. Others in the past
And we
year,
can talk, we'll talk about specifics. So we'll hold on to Jeff Bland's charity. And Jeff Bland, for those of you that don't know, is one of the main founders of functional medicine. I believe him and his wife coined the term functional medicine. So you talked about you can go, you like dealing with the youth, finding a place where you can, and you're talking about taking the knowledge that you know and trying to pass it on to the youth to make the world a better place.
yeah.
So I guess here we can kind of go back to like now those specific charities. So larger scale organizations you like donating to. So you like donating to Jeff Bland's charity. Tell us about it.
His is, I think, on functional medicine education, and I'm blanking on the name. And I just wrote the check here. I had money at the end of the year, and I said, here, I wanted to go to a good cause because I bought a domain, Women Healing Women. So my goal is to really fund functional medicine training
Okay.
and then fund the treatment.
Are there any other organizations that you believe that you believe in donating to?
So I have personal ones. So I did a charity trip to Ethiopia. So I donate to Catherine Hamlin's Fistula Foundation. So they tend to be
Okay.
medically related. Here locally, I donate to Feed My Starving Children. So not only time, so we volunteer there, but we donate money. So off the top of my head, there is a women's charity I just donated, like Dress for Success. So it's not only clothing for women trying to get back on their feet, but then it's also, you can do money, you can do coaching. And so I've had a little bit less time with some family obligations, but yeah, I try to spread it out where it's just like, think about it. If you do an hour a month, that's 12 hours a year. If you do an hour a week, 52 hours, that's like impressive of time. If you do, set aside 10% of your earnings every month, you should, and I try to teach our kids this too, is like, well, what charity are we gonna target this year?
So Dr. Campbell, Ellie Campbell was on the show and she did something interesting. She had a percentage of the revenue they generated and she would have her staff decide where it went. I environmental work group has come up a lot, the EWG, where people will donate to environmental work group. And I know for our office, we've had times where we said, okay, this month, 10% of what we make, we're going to give to environmental work group. And I like donating to the Institute for Functional Medicine. That's where I learned my initial functional medicine knowledge, and I continue to teach with them, but I also believe in them, and they're a non-for-profit. Is there any other organizations you can think of that are helping make the world a healthier place?
A healthier place. Oh boy, there's probably so many. I haven't explored them all. So yeah.
I think the Jeff Bland. Let's stick to Jeff Bland's charity, and we can mention that below as well.
Yeah.
Any last thoughts or words for our audience?
No, I mean, even like I used to speak to my kids' school on eating the rainbow. You can start educating down to from kindergarten on up. And one of the things I wish they would teach in all schools and they don't is, stress modification. So bring in breath work or some of the breathing techniques. And there's plenty of organizations looking. The one here local is called Kids Matter, and it's for rising juniors and seniors. And I did the talk was nourishing your mind, body, and soul for success. And I gave them tips within each.
Well, thank you very much. One of the most precious, valuable things we have is our time, and you have been very generous with your time. So thank you so much. How can people that want to stay connected with you stay connected with you?
So social media across all platforms, YouTube, LinkedIn, Instagram, Facebook, is at DRRAJKA. My website, drrajka.com. And then the emails, info at Simply Health Institute goes to the clinic. So if anyone has an inquiry about anything.
Awesome. Well, thank you so much, and I'll see you around.
Okay. Thanks for having me.
Hey everyone, I'm Dr. Yousef Elyaman. We hope you enjoyed the show. For more exclusive content from this interview, check out our FMP Essentials Mastermind. Make sure you check out our website at www.fmpessentials.com for our blog and other content. If you enjoyed this show, please, please, please subscribe. Give us a like. It helps way more than you could imagine. Thank you for watching. Follow us across all social media platforms at FMP Essentials HQ. Please don't forget to share this with your practitioner friends, and we'll see you in the next episode.